slim crowd today.
Yeah.
It's 9 o'clock on August 3rd, 2021. Call the Health Committee meeting to order. Amanda, would you call the roll, please?
Bard,
Yes.
Curtis.
Yeah.
Zumwalt,
Present.
Sure.
I'm here.
I imagine you've all heard or read that Barb Awful's husband passed away last Saturday. Visitation is Thursday from 4 to 8 at Napfredinius Funeral Home in Gilman. And the funeral is at 10 o'clock at Trinity Church out here on the east side. So remember Pete and also Barb in your prayers. Is there a motion to approve the agenda? Mr. Curtis and Mr. Zumwalt. All in favor, say aye.
Aye.
All opposed, same sign. Is there a motion to approve the claim? Mr. Zumwalt? Mr. Curtis, second. Amanda, would you call the roll, please?
Bard,
Yes.
Curtis.
Yes.
Zumwalt,
Yes.
Sure.
Yes.
Are there any public comments? Animal control.
I guess most of you may know, those of you that don't, Dr. Youssef has resigned as the Animal Control Director. The two wardens, Linda and Marion, are here with us this morning, wondering what's going to happen. Right now the situation is pretty fluid. We're trying to see if we can find somebody that can take his Youssef's place. But I don't really have anything definite to report on it at the moment, so we will continue the search. There are only 2 other vets in the county, and right now we're not making a good connection with either one, so I'm not sure what we're gonna do, but I believe the Watsika Animal Hospital is for sale, lock, stock, and barrel, and if you know any vets that would be interested in something like that, why, you can refer them and talk to me about being involved with animal control.
He's been part-time for a while, hasn't he?
No. No, he's been full-time animal control director for
Yeah, but I mean,
9 years, 8 years,
7 or 8 years.
somewhere in there.
do they have to be veterinary?
Yep. Yep, the statute has certain requirements regarding that position, and one of them is being a licensed veterinarian. And there are things that the veterinarian or the animal control director is required to do. For example, the dog tags that everybody is supposed to purchase for their dogs or cats every year. The county is the one that, in a sense, issues those, and people pay their money for them to the county.
Yes.
But we can't buy the tags. The animal control director is the one that orders those and pays for them, and then we reimburse that person. So that's just one example of things. But anytime there's any activities involving a rabies case, for example, whether it be with a dog or a cat or a bat, that has to be involved with that, because that animal has to be going through a testing process down in Springfield to determine whether rabies is present or not.
Right, positive.
So there's a number of things like that. If an animal is picked up by one of the wardens, it's supposed to be examined by the vet, evaluated and so forth. Usually they give it a flea treatment and just an overall exam to see if it's need of any kind of health problems, certainly they check for rabies.
Yeah.
So, I mean, these are some of the things that the vet has to do. And then there's a matter of animals that are picked up that have to be boarded. Well, we either try to find their owner or whatever for a period of maybe 10 days or so, and then they can be taken to a shelter.
Mhm.
In some cases, the animals have to be euthanized because they're not deemed to be
Yeah.
worthy of adoption or they're vicious animals and dangerous in some respects. So, I mean, these are some of the kinds of things that has to be involved with.
There's a young gal over in Gilman.
Yeah, she just started about a year ago.
Right.
Has she been?
I've been attempting to make contact with her. I use the word attempting. Our results have not been very satisfactory.
What do we do if we can't find her?
Does she have to be in this county, or the vet have?
I don't believe that has to be in this county, but it certainly is preferable because of the interaction between the vet, the wardens, and the county here. That, you know, if somebody's some distance away, that just complicates it and makes it a
Well,
little
there's
harder.
one, I forget to have, there's one in Piper City too.
Right, the one in Piper City has got a situation right now where Dr. Whitman has got serious health concerns and he's limited in the office. He has an assistant who's a vet. That assistant just had a baby about 10 days ago. So that situation isn't.
I know my son takes his horses over there all the time.
Yeah. So just in a nutshell, it's, you know, we're working very diligently trying to see if we can't come up with an arrangement that will be satisfactory going forward. But in the meantime, people are gonna have to be patient and bear with us. That's all I can suggest.
Has there been any price that has come up as far as what use of wanting for his practice?
Well, I probably shouldn't really
Well,
talk too
yeah,
much
I mean-
about that. That's something, I believe he's got a broker
Okay,
that's handling that, and I don't know what kind of number that person has had. I know he's had some conversations with me. He's trying to get the county to buy his practice. It's not the kind of business the county should be in, number one, and number two. It's just not a good deal.
yeah.
And I can go into details if you want after the meeting, but it's just not.
Yes, Mr. Shipper.
John, in the meantime, if we have someone that meets the criteria to be tested because they've got a bat that they found in a bedroom, or they've handled the bat without gloves, or they think that they've been bitten by a bat, in the meantime, do you have any suggestions of what we would do?
Well, we've had a couple of situations where we've been able to work with the people up in Kankakee County.
Okay, that's where I'll reach out first. The state won't take, a live bat, and only because bats are a protected species, they can only be killed by a licensed veterinarian. So they have to be humanely euthanized, and then the bat can be sent for testing. Same thing with a dog or a cat, but it's imperative that we get them tested so that people, if there's no animal to test or we're unable to test an animal, then we have to recommend through the health department rabies prophylactic, post-exposure prophylactics. So rabies vaccines cost, some insurance companies will cover them and some won't, but if they don't, they cost upwards of $20,000 for the series. And there are always some side effects to getting that. You don't want to give healthy people rabies vaccines. So I'm going to be very hesitant to recommend that, but on the other hand, if we don't have an animal to test, I'm going to have to recommend that they go through that, because If we don't, and somebody gets rabies, it's on me. So, we've got to have a vet. I mean, we've got to have a reliable person to process these animals so that they can go to the state lab for testing, so that people don't have to go unnecessarily through rabies vaccine.
I agree with you. On the other hand, the law doesn't give us the authority to force anyone to take on that responsibility.
I understand that. I do.
It's quite
I'm just trying to tell you that this is gonna be a problem for the health department, a big problem.
I was in Champaign yesterday, and it was my intention to stop by the University of Illinois down there. I just ran out of time and wasn't able to get it done, so I'm gonna pursue it further. In the meantime, as I said, we do have arrangements to work with people in Key County, so if there is any of those kinds of things, we're dealing through them.
Do you have contact information?
And
I mean, I can just call their
Brenda
general.
and Marion went over that, and Joe Johnson is working with that on them as well. So,
Thank you.
Was that a full-time job,
what,
vet out here?
the practice that Yusuf had out here was a full-time practice, yes. Our part of it was a small part of his overall practice, as far as that goes, and always will be. But, as I said, you can't.
I guess what I'm saying is, like, if you got one from Piper City, and you work like 2 days a week over here, can you do that?
I would go and talk to the people in Piper City about it, if I weren't for the, I know the situation.
Or the lady in Yeoman, you know,
Tell
I'm
me
sure
how-
she's not that snowed under in a town the size of Gilman.
You tell me how I can talk to her, and I'll be glad to do that.
Well, go to her office. Go to her office.
I did, it's all locked up.
That shows that she needs work.
I think she does Lauren Jan.
Huh?
I think she does Lauren Jan.
I think they bring them in the alley and she goes out and, yeah, shoot some more.
I called on the telephone, I knocked on, gone to the office, there's a sign on the office, under construction, nobody.
Yeah, well, she's adding another building onto her practice.
Both doors are locked.
I don't know.
She called me back once and indicated she would help out with a few things, but she didn't want to get very much involved. And that might work temporarily, but if that's gonna be her attitude, it's not gonna be a long-term solution.
And Doc Joe out here, I'm sure, has no intention at all of taking over the responsibility of animal control.
Well, and, it's like anything else, there's a lot of headaches involved with the situation.
Yes.
It's not a piece of cake.
I know
And
an individual that's a veterinarian up at Bradley Animal Clinic. And I was talking to her, and she said, of all the vets up in Kankakee County, there's really not anyone that's anxious to do anything but to have anything to do with animal control.
Say if we could hypothetically recruit a new vet out of U of I, could be like, provide like a small business loan or something to get her started over here, or.
well, the county does have a revolving loan fund, so I suppose something like that might be possible. I hesitate to commit to anything like that until we actually see it materialize. That's a possibility.
The thing of it is, when this year's graduating class has already graduated, so they're pretty well all established with a clinic or one
Well,
other vet.
here's what I know about as far as the University of Illinois, and the same thing exists with the University of Missouri. And I believe probably any other state that has a similar situation with the veterinary school. They maintain what you would call a placement service
Yes.
for their graduates, okay? And that isn't necessarily for new graduates. That can be, you could be 10 years someplace and looking for a new job. And the jobs are listed and posted right on the internet. If you go on the internet today and look up the University of Illinois Veterinary School and follow the link to alumni, and then it'll scroll down and say job listings, and they've got, I don't know how many, the listings go way back. I scrolled through a lot of them. And what those people are being offered is pretty good pay.
Yeah.
It's well up in the six figures. And so, I mean, it's obvious there must be a shortage of veterinarians and throughout the whole country.
Yes.
Looking at the job listings. So, that being the case, all I can tell you is I'm working hard. I'm trying to get the situation resolved. And right now we need all the help we can get to get it resolved. So I think the one official here in the county even asked me, do we really need animal control? And I looked at it and I said, yes, I think we do, but getting all the pieces put together is not an easy task. So right now I'm very grateful that we have two wardens that are working hard to help us out, very cooperative and very interested in getting the situation resolved. You can see they're here with us today. That indicates their level of interest. But here again,
Do they have anywhere to take the dogs and cats and things?
I've been searching through up and down the width and breadth of the county just for a building that we can put them in. Can't even find that. It's amazing. In a county this size, there's no place where there's a building, maybe 30 by 30 building that has running water. That's all it needs. We can provide air conditioning and heat as the need arises, but we can't even find a building available for it. At least we haven't so far. I've talked to a lot of people up and down the county again about it. I mean, if you know someplace where there's something like that that can be used temporarily, you'd be doing us a great service. But that's kind of where we're at.
He sure didn't give us much notice, did he?
2 weeks.
2 weeks.
Sent me an email on July 17th, said the 30th will be his last day. Last Friday. So we went over there on Friday and picked up a few pieces of equipment and other files and so forth, and brought them over here.
Did he own that building or the county own it? Did he own that building or?
Yeah, he owns the building.
Can we buy it? Can we buy it?
Oh, we could, but if you want to buy a white elephant?
Well, if we have to have it. If we have to have it.
Chairman, what are the requirements for the position that you're trying to fill?
It has to be a licensed veterinarian.
Okay, and you said that you just are needing a facility for that veterinarian.
Did what?
You're needing a facility to put the veterinarian and have a place.
No, the veterinarian will find his own facility. Right now, we need a place for any animals that are picked up.
Okay.
You need to have a place to keep them. It could be for a week while we try to find the owner, or if we can't find the owner, then we're going to adopt them out. But usually we keep them for a week, maybe 10 days, 2 weeks, somewhere in there. No longer than we have to, but there has to be a place to keep them. They have to get fed. They have to be watered. They have to be taken out to relieve themselves, that sort of thing.
Have you talked to the area, like, facilities that are already housing animals too?
Yeah.
Are they full? We'll address all that.
There's some places in the county that I would prefer not to do business with. And there are a variety of reasons for that. I don't think it would be in the best interest of the county to do business with them. It's nothing personal.
Is that the eye care over your koi?
They don't have a licensed vet.
Yeah, I know.
So why would you consider someone that doesn't have a licensed vet?
I'm just for storage or whatever.
Oh, yeah, okay.
This-
So anyway, that's where we're at. Not very good, but every problem has a solution, and that's what we're working towards. I think by the time we meet next month, we'll have some encouraging news to report. I'm optimistic we will, but in the meantime, like I said, if anybody can help us out, we're finding a place to temporarily house the dogs and so forth, that's what we're looking to do. That's our main focus right now, as well as wanting to find a vet that can take over the business. To me, a vet that would take over the business here wouldn't necessarily be someone fresh out of college, although I don't, that's a possibility, but someone that's had maybe 5 or 10 years experience that knows a little bit about running a business and has also the experience of dealing with the public is someone that would be better qualified to pick up the pieces here and get things going again. In my opinion, Watseka and in the surrounding area, there's enough pets and so forth that a veterinary business ought to be able to thrive. But again, that's a matter of getting the pieces in place.
Yeah, finding the people.
Chairman, have you put an ad in the paper or like done anything like that? Or is they, like, how far is the outreach looking for this position to be filled?
Well, it's not our responsibility to find someone,
Okay,
and I can't really put an ad in the paper
right.
for it.
I didn't know, who's responsible, how do you go about it? That's my question.
Well, as I explained, I'm intending to talk to the people at the University of Illinois and probably the University of Missouri for another one.
I know Purdue has
Is it a
veterinary-
full-time job?
A veterinary clinic too, I know it's like,
Or is it 2 days a week?
I mean, I just don't know how this position gets filled. You know, how was the person, how were the people found before to fill this position?
Just approached, I guess.
Okay,
If you ran a gas station in town and you wanted to sell it and retire, what would you do? You might find somebody before you close the doors to come in and work with you with the idea that they would take over.
of course,
That's in the practices like this is usually what happens.
right,
If a medical doctor is running a practice, he'll either usually get someone come and working in his office to take over,
right,
or at least have arrangements for another physician to come in and take his patients. None of that happened in this case.
and,
The doors got closed and boom. So, I mean, there's a lot of people with pets that are left out in the cold right now, scrambling around to try and find someone else that they can go to meet their pet's needs. That's not the county's responsibility.
sure,
Our responsibility is trying to find a vet willing to take on the task and the responsibilities of animal control. And if they, if they don't want to do it, we can't force them. I can't go in and say, here's, the county passed an ordinance, you're it. Doesn't work that way.
what about local, workforce, like, job seeker services that are here within the area? Would they be able to assist and send out?
I think that, to me, the best avenue is working with the universities. If I was a vet, I'd be looking at the job listings that they provide if I was wanting to find a new position.
Right.
Whether I'm a recent graduate or been a vet for 40 years, whatever. If I was looking, I mean, that's kind of like
Right, it's like the hub.
I mean, anybody can post a notice on their website. And that's what I'm gonna talk to them about, to see what we might be able to post on there,
Good.
if anything, that would identify the situation. Because
That's good.
we're not the one that's selling anything, we're not the one that has anything to do with who might come here.
Sure.
If somebody comes here and wants to buy the existing business, they have to deal with the former owner, not anybody here at the county.
Sure.
It's kind of a, between a rock and a hard place is kind of where we're at, you know. So. Okay.
Okay, moving along, Iroquois County Public Health Department, Mrs. Shepherd.
Again, good morning. I have a program summary report to share with you. Anybody else would like one? Certainly have one, thank you. So, let's talk about that first today. It's been busy, as you can tell. Some things I just thought I'd point out to you are under environmental health, we had 34 temporary food permits issued just in July. That's a big number for us. That tells us there's a lot going on out in the community. People are ready to get out and do things. I don't ever remember seeing a month where we had 34 before, but that's good. That's a good thing. We did 13 water samples in July. Usually we hit those hard March, April, May, June, but we still had 13 in July. We had 11 new well inspections during the month of July. That's a lot. The West Nile virus surveillance, we collected 45 mosquito samples from 5 sites around the county. None of the samples that we've tested so far have tested positive for West Nile virus, so that's a good thing. I'm skipping through this pretty quick, so if you see something on this list that you want to talk about, just jump in.
You'd say from 5 different sites.
All 4 corners of the county and then here in Watsika.
Okay, now, do you go to different places at each site?
No, we have what we do is we have a trap, a mosquito trap set up in those sites, and then we go daily and collect those samples.
Okay.
Those samples, are in a machine that's battery operated, and we use rabbit food just because rabbit food and water attracts mosquitoes so well. It's cheaper than the products that you can buy that attract mosquitoes, so we just use rabbit food. That attracts the mosquitoes. They go into the machine, which is battery operated. A fan carries them up and they get trapped in a net. And then we go collect that net and then take it back to the health department. Mosquito samples go into a freezer, and then the staff have to hand pick out the mosquitoes out of the net and separate the different types of mosquitoes. And then the ones that carry West Nile virus are collected, they're ground up, and then we test them here at the health department.
Okay.
So we did that. We did 45 samples during the month of July. We'll continue to collect mosquito samples through September.
Every month?
Every day.
Every day?
Every day.
Really?
Yeah. As soon as we find a sample that has West Nile virus present, then we will issue a press release and notify the public and start, really having putting out notices for people to watch standing water, like in tires and bird baths and in things around their yard, because you want to protect the individuals from West Nile virus, because that can be very that can be deadly. But those people tend to get very sick.
Under the well section here,
Yeah.
it said that there's 31 permits issued for sealed wells.
Yes.
Doesn't match the sealed well inspection, which is a 28.
Okay. So that's true, because we do the inspection, and then sometimes it takes a while for somebody to get to seal it.
Oh.
So it may fall into a different month. It could even fall into a different year. A lot of people do seal them in the winter, which is, you wouldn't think that they would, but they can. So yeah, that doesn't, and they, once the inspection's done, some people, it takes quite a while to get a contractor out there.
Okay.
And then those carry over to the next year, Yeah. All right, because you're looking at the FY20,
Yeah.
fiscal year 20, yeah. And sometimes they're asking us to inspect it to make sure it's sealed properly, And so sometimes they don't even notify us that it got sealed until a month later. Or sometimes even longer. The Radon Kits, we distributed 18 Radon Kits the month of July, so we'll see what comes back with those. So that's under environmental health. If you flip to the next page under community health, did you guys have any questions about environmental health? If you go to community health, you can see that the girls have been busy giving vaccines. They gave 72 childhood immunizations and 4 adult immunizations during the month of July, and gave 90 COVID vaccines. Now, we were running big numbers. And then in June, it dropped down from May, where we had almost 800, to only 174 in June and only 90 in July. We're having a hard time getting people to get vaccinated, and we'll go over that in a little while. You see, though, that in June we had 91 cases, and in July we had 127. August is going to be worse. Our numbers are up. And we'll talk about COVID in just a little bit. We had the 7 animal bites, 4 dog bites, 3 cat bites, all were quarantined. Of those COVID cases under COVID outbreaks, you can see that we had 3. 2 of those were at businesses, and 1 was at a long-term care facility. And it was with their employees, not their residents. We had a Haemophilus influenza invasive case, which is kind of rare. That was a 5-month-old who had been vaccinated. The family and contacts have been vaccinated, and we're right now awaiting serotyping on that. The hepatitis B, both of those ended up being not a case. We had to do full investigations on them, but both of them ended up being not a case, which is so good. Hepatitis C, those 8 cases, 4 of them have already confirmed out, and we're waiting on the other 4, but they're probable. They'll confirm out. The histoplasmosis is a probable case. We see that quite a bit during the summer months. As far as the rabies investigations, 2 bats tested negative, and then 1 was a mole bite, and we contacted Dr. Connie Austin, the state veterinarian, and she did not recommend testing for the mole. We had a spotted fever rickettsiosis case, which is kind of rare. People call that Rocky Mountain spotted fever. That is a disease that you get from ticks or mites. But instead of being viral, it's bacterial. And that is a probable case, but we'll never be able to definitively know because the client died before we received the lab result. So once we received the lab result, the positive lab result on that, we called the hospital, and the person had already died like 2 days before that. So we can't do any further testing there. The tuberculosis numbers, we have a new case investigated. We did have someone that had a positive T-spot result, so we're working on that. It's very possible that that person will come back with positive saliva samples. If they do, that person will be placed under quarantine. As you know, we do all active TB cases, and we'll go from there. And then we provide them medication. It is a state mandate that people who have active tuberculosis cases have direct observation therapy. Direct observation therapy means one of the health department nurses watches them take their medicine every day. And that is so that they don't develop a mutated strain of tuberculosis. Because we all know what can happen when people don't finish their medicine. And TB meds, go on for months. So for months, we go watch them take their meds because they start to feel better. It's kind of like people do sometimes with their antibiotics. They start to feel better, so they don't finish them. Well, all you do then is create a mutated strain because you don't take that medicine long enough to kill it off completely, and then it becomes medicinal resistant to that medicine, and you create a superbug. And we can't have that with tuberculosis. So the state mandates that the health department go and do direct observation therapy on active tuberculosis cases so that you don't end up with an outbreak in your community that's medicinal resistant. So we'll see what happens with this one. We've done it before.
All the hype about Lyme disease, I'm surprised there's not more cases.
Yeah, we usually see a few of those in the summer, and right now we're not seeing it. So we've had 1 in May, 2 in June, none in July.
Are they all, do you think they're all reported to you, or do you know?
I think, here's what I think. If you're asking for what I think, I think that a lot of people go to doctors, and if you have a doctor who is aggressive or very concerned, they will have that person tested, and then we'll find out. But I think because Lyme disease signs and symptoms are very similar to other diseases, a lot of them just diagnose other illnesses, and I think some of the Lyme disease goes on undetected.
Yeah.
That's what I think. I think there's more than 3 cases this summer in Iroquois County. And some of those oftentimes are people who travel, and they travel to areas where there's a higher incidence or rate of Lyme disease than in Iroquois County, because we don't see a lot of, this is not one of the areas where we see just tons and tons of ticks. We see ticks, but like you go down to southern Illinois, like the Marion region, and get toward Paducah, those ticks are everywhere.
If you want to see severe ticks, you come to my house. Thousands and thousands of them.
Yeah.
They're bad for dogs.
Yeah. Yeah.
Every time you go outside, you come back in.
You got a tick?
See one crawling.
Yeah. Yeah. The country areas especially, yeah. We have a new community outreach program at our health department. I decided that we needed more community outreach. Especially when we saw last year, even during the pandemic, and even now, our chlamydia cases look at our chlamydia cases. Now, we only had 1 in July, which is amazing, because May we had 6, and June we had 3. And our gonorrhea cases, are up. And I felt that the best way to prevent those kinds of things is through education, making people aware that we're seeing medicinal resistant strains of gonorrhea now in Iroquois County.
the best way to educate, and most of those, I'm just gonna be honest with you, are in the younger population. You know, it's not grandma and grandpa out there spreading these diseases around. Let's just be honest. So the best way to prevent some of that is to make these kids aware of what can really happen to them if they get these diseases, and especially if they get a medicinal resistant strain and the body damage that will happen inside their body before they, are treated. So,
Toughen out.
yeah. So we started a new community education program. We're also offering CPR to the community now. We've had lots of different places ask for CPR trainings. We've got them set up at the different libraries throughout the county. We're doing all kinds of new community outreach programs involving all of our programs. So I think that that's going to be a good thing, because the more you inform people, the better they can make it, an informed decision. So about the choices that they make. So that's a good thing. So that's something that we'll be doing. We've stopped our COVID posts, press releases, from daily. We went from daily to doing it just once a week now, doing numbers once a week, and are starting to focus on things like school guidance, World Hepatitis Day, West Nile virus prevention, those things, to try to get some of these other things that are starting to creep up on us, because we've been so focused on COVID for over a year and a half that some of the other things have taken a back seat, and we need to get back to those, because those things are creeping up as well, and we don't want that to happen. And then, we're back doing vision and hearing screenings in the schools. So that number, which was 0 in July, we're doing the preschools and the summer programs now. Those numbers are going to pick back up, because the schools are going to let us in this year to do vision and hearing screenings, and hopefully we can get our dental sealant program back in schools and do those sort of things. Our senior services program, our numbers are still what I consider high. We have 185 current clients on the community care program services, and those are services to keep individuals in their home by referring them to resources and setting up things that can help them stay out of a long-term care facility and stay in their home, help seniors stay in their homes. We did get a new grant, and I applied for $600,000 in funding through the Illinois Department of Aging, and I was notified that we will be getting that grant. And that grant will help seniors in our communities, help them with buying groceries if they need groceries, because so many people are on such a strapped income, tight income. We have seniors in Iroquois County who have to decide every month whether they're going to buy their medicine or buy their groceries. And that's sad.
Yeah.
That's sad. So this will help with groceries. This will help with things like a wheelchair, a walker, a cane, a grab bar for their to go so that they can get up and down off their toilet seat.
Yeah.
Grab bars in the showers, any kind of aid that helps them in their home. So if you have, if anybody who's age 60 or older who needs some help with those kinds of purchases, we have grant funding available.
And what was that called again?
That's a Senior Services Emergency Grant,
Okay.
and it's through the Illinois Department of Aging, and they allowed us to apply based on using our community care numbers. But this is for anybody 60 or older in Iroquois County. We aren't going to say that it has to be one of these 185. When I applied for this to be for our community care clients and anyone over the age of 60 who could use a hand. Because there are a lot of people that need help.
Yes.
Yeah, yeah, yeah. We haven't officially gotten all the paperwork back for it. So as soon as I get all the paperwork, but we've been notified that we will receive this grant. So once I get the signed contract back and I sign it and then it goes to them for final signature and comes back to me, then we'll advertise it.
Okay.
Definitely. We'll spread the word because we that's what we do at Public Health. We help people and we protect them and we keep them, as healthy as we can.
I see there's a lot of people going in and out of there. Your office, where they want, get
Shot
various things.
immunizations, or they might want,
Help
food
with-
permits, or they might want help with something, if they're seniors. Our clientele that come in every day want different things, they could want anything from a Radon Kit to test their home for radon, or they might come in for a TB skin test because they've got a cough and their doctor says, you might want to go to the health department and get a TB skin test. Or right now, we're going to get really busy with back to school immunizations. Tetanus shots and, measles, mumps, rubella, polio, meningitis shots, those things that are required for schools. We're going to get really busy with that. And we'll be busy. Our appointment book for our office nurse will be solid from mid-August through mid-October when the deadline is. Even though we've been putting out press releases and contacting, local newspapers and radio stations and encouraging people not to wait till the last minute, the school deadline for immunizations is October 15th, and you'd be surprised how many parents wait till the last minute. And we'll get busy. We'll get super busy. And then at the same time, we're gearing up for a flu season. So things will get very, very busy. We didn't have a lot. We didn't see the numbers for flu last year because of the social distancing, because of the masking, because people weren't attending large events. People were, staying 6 feet from each other, all that stuff. So we didn't see the flu cases in Illinois that we normally see in a typical year. But with people, frankly, being tired of all that, more and more people are getting together for social gatherings and attending fairs and attending, and we're going to see more and more flu cases this winter as you see less people using those precautions. So we're going to do some major promotion for our flu vaccines because, that's important.
Okay. Well, and thank you for all the reports, Dee. I'm sure you're out there on the front line with COVID and
Our COVID cases are definitely increasing. We're seeing the Delta variant in Iroquois County more and more and more.
Okay.
We're going to get to the point where most of the serotyping that comes back will be the Delta variant rather than the
Are they still doing it out at the hospital
yes.
every day?
Yeah, there are 5 places here in Watsika that test. Iroquois Memorial Hospital tests, Riverside, Carl, CVS, Aunt Martha's, and Gibson Area Hospital, so we have 6. Walmart was testing, but I think they're just vaccinating now. Are they still testing? You guys know?
I think so.
I don't know. But those other 6 places are just here in town. So we're not providing testing at the health department because we're focusing on vaccination. Because there are so many other places in town you can go and be tested. So, thank you.
Thank you very much, Mrs. Shepherd. Sounds like you're gonna keep him busy as always.
Yeah, if you saw our last report, the hospitalizations are way up. These people who are getting the Delta virus are sicker
Yeah.
than the people who, got an alpha or gamma variant.
Yeah.
These people are sick, and we're seeing it.
Okay. Thank you very much.
Thank you.
Is there any old business? Is there any new business to come before the committee? Do I hear a Motion to adjourn. Is there a second? All in favor say aye.
I-
All opposed, same sign. We are adjourned.